everyone suffers from some form of addiction. It's just that individuals who use substances has a negative connotation on it based on what society expects and society's role in it. But you can be addicted to your phone. You can be addicted to watching TV. All these are some form of addiction, but when we label people as negative words and terms, it doesn't help them. My name is Michael Kumako. I'm a harm reduction support worker, and I work at Positive Pathways Community Services. My role in the community opioid substance crisis has been to educate, provide safe equipment in terms of injection and safe inhalation equipment, and also sexual health supplies to clients who need it. In terms of our organization, we've done a lot. We've done a lot of work going from the WECOSS, participating in those meetings, and meeting people in the community, and getting their feedbacks in ways that we can develop our service and ways that we can address this opioid crisis. The needle syringe program is a service that we have at Positive Pathways, and it's all about safe use, best practice and safe practice for individuals that want to use substance, right? So we provide safe inhalation supplies, safe injection supplies. We provide naloxone as well, right? The medication that temporarily reverses an opioid overdose. And anyone can come in and we just service them and also provide education in that aspect as well. Harm reduction varies from individual to individual, right? We understand that harm reduction looks at, reducing the health and social effects of substance use. And in a way, it benefits the individual and the community at large. So we see that in a way, harm reduction reduces the crime rates. It also increases the exposure of individuals that use substance to get reintegrated in society and be productive members. Also, we see that harm reduction also reduces the number of discarded syringes and needles that we find in our safe places. And lastly, harm reduction also, provides referral to other community services. The way that I personally would define harm reduction is, it is the ability to give that choice, that power, that free will back to the individual to choose which avenue towards success, which avenue towards wellness that they want to achieve. And while you're there to be in a supportive role. You're not going to come in with a hero cape. You're not going to come in and be like, I'm here to save the day. You listen to them, you practice active listening skills, and find best way to help them achieve their wellness. So working in the needle syringe program day by day, we see that we've taken a lot of new clients. There's an intake of more clients than what we usually had pre-COVID-19. And I'll be doing the disservice if I don't say that, it's been extremely stressful. Clients at times break down, they share with us their stories, right? They've gone to the point of stating that they know they're not supposed to be doing this, right? They know they're not supposed to be doing this, but for the time being, this is where they're at. And we try our best to meet them at where they are. We try our best to meet them at their point of need, where we understand that this might not be the time for them to seek a different avenue. So we're here to help them in any way, shape, or form. People do mention that, well, you guys are enabling individuals to use substances, and that is not true. Harm reduction is non-judgmental, so it means that it's not for or against substance use. It's neutral in its stance, right? What we see is that substance use is going to be there. It's a part of our world, right? And we've taken a role, we've taken the initiative to make sure that we address these harmful effects, right? Rather than just letting it be or just ignoring it entirely, right? We want to take a stance, we want to take a role to address these effects and not just let it be. So we noticed that some people do have a perception that people should be mandated to take treatment. But once again, we can't forget that you're taking away from that person's free will. You're taking away from that person's choice to choose what is the best for them, right? They cannot be forced to do something that they do not want to. So it's important that we give that person's free will. Just like how I define what harm reduction is, it is giving that empowerment back to the individual to choose what they want to do. There is a perception that the war on drug is the only way to stop drug use, but once again, drug use is always going to be there. Substance use is always going to be there. It's how we minimize the harmful effects of drug use. You cannot pick and choose what you want someone to do, right? So knowing that, it's once again upon the person, it's that person's choice to do what they want to do with that, what they want to choose and exercise. We can't have that mentality that, okay, we have to go directly on drug use. It's about minimizing the harmful effects, because drug use is always going to be there. It's a part of our world. I believe we're all responsible in terms of addressing this opioid overdose crisis. And it starts right from the top, the 3 levels of our government, right? It starts from the federal, the provincial, and the municipal. It starts with us, right? I thought in the beginning, around 2017, that the question I formatted was, who's gonna take care of this? Whose responsibility is this? Someone gotta fix this. So now that I'm working in this sector, now that I'm working in this field, I really see that it's upon everyone to address this crisis. It's upon the community, right? Our partnership, our groups, to make sure that we address this, because it's been going on for so long. If we're a community where we talk about embracing one another, we need to figure out this issue. We need to fix this issue. As a community, I feel like people have come to the realization that this opioid crisis is really having a negative impact on everyone. I feel like there's more educational aspects going around. I feel like people are willing to get involved. I feel like people are willing to be educated on safe use and safe practices. In terms of people having the idea that individuals who use substance are still people, and they should be treated with compassion and respect. They should be treated as though they are individual and not label them or stigmatize them based on what they do. I also want to point out that, let's say an individual has decided that they want to completely stop using substances, and then they meet someone on the street, and then that person says a negative connotation to them, calls them names. Now this person thinks, okay, this individual that just called me name doesn't care about me, so I'm just gonna continue using. I'm just gonna not seek help that I need. So it's important that the words that we say really, it has an impact. We have to be mindful of what we're saying, because it can really change someone's life. There's still a lot of people, there's still a lot of individuals that need to be educated, that need to know what is going on. Yes, they do see it, but at times I feel like they don't know what is the right step that they should take, right? And I know through the Label Me person that we started up in 2019, right? We went to different public places. We went to the hospital, we went to St. Clair College, University of Windsor, to get people involved. So the way I see is that there's still more work to be done. There's still more people to educate on ways that we can address this crisis. The perception that only individuals that are within the downtown core only use substances is not true. Any individual can use substance. We can't forget that when someone, let's say, has a pain, a chronic pain, and let's use an example of in their arms, they'll get painkillers from their physician, their doctor. And in a way, that painkiller reduces the pain that they experience, correct? So taking that as an example, they might take it once again and be like, okay, I don't feel the pain. I don't feel it, it's gone. But also there's that way that they can fall into reusing that substance, reusing that painkiller, and then it just happens. It happens that they begin to just use substances. So it's not just strictly based on individuals that use substance are only in the downtown core, they come from poor backgrounds or low socioeconomic status. Anyone can be affected by it. Yeah, stigma obviously creates barriers to people that want to access services, because based on what someone says about them, they will have that mentality, they'll contextualize it and then impose it upon themselves, right? This will cause them to stay away from getting improvement to services, staying away from treatment services because of what someone has said to them. Our words have power, they have meaning, and they're impactful, so we have to be very, very mindful of what we're saying, very mindful of what we're saying to individuals, and also what we're saying to ourselves as well. I believe the Label Me a Person campaign has been huge. Just extraordinarily huge. Like I mentioned earlier, we had the opportunity to go to different community sectors. We were at the hospital, the St. Clair College, University of Windsor, engaging people on what label me as a person means, the campaign, and how stigma affects everyone, even those individuals that I use. So the Label Me Person campaign has had a huge influence, positive influence, on how we can address the stigma in our community.